All right, welcome back. Quite an emotional edition of Morning Live, I must say. All right, well, let's change tack a little bit here and let's talk health. The conduct of health professionals and transformation in the sector is under the spotlight this week. From Monday, the Wits University's Faculty of Health Services and the Steve Biko Centre for Bioethics has been hosting Ethics Alive 2017. It's a 5-day program of debates and discussions exploring the ethics, law and human rights in healthcare practice. To tell us a little bit more, we're joined in studio by Professor Ames Dhai, Director of the Steve Biko Centre for Bioethics. Good to have you. Welcome to Morning Live.
Good morning. Thank you for having me.
It's an absolute pleasure. So, we talk about ethics in health professionals. It's always been one of those thorny issues in healthcare. How has the law become unaccepting of bad behaviour of health professionals over the years?
Yeah, I think before we even go to the law, we need to ask ourselves what's happened to the caring professions. And we've seen this over the last few decades where there seems to be just a decay in ethical practice and professional practice. So in terms of the law, what we have is we have our Constitution, our Bill of Rights, which actually includes in several sections the rights of our health, of our patients. We also have our National Health Act, and Chapter 2 of our National Health Act is specific to issues like consent and confidentiality. And then this then gets teased down to our regulator, who is the Health Professions Council. And the regulator has come up with a number of policy guidelines in terms of our professional conduct. And in terms of our professional conduct, what's to be first and foremost is caring and compassion.
Yeah. But sometimes it's very difficult to be caring and compassionate when you're working under the conditions that some of our healthcare professionals are working under. Exceptionally long hours, short-staffed, under-resourced, underpaid, if paid at all. These are some of the stories that you get where people are desperate and, it obviously reflects on the service that they give. How do you get around something like that?
Yes, there are challenges to professionalism. However, I think, being in the healthcare profession comes with a certain degree of a calling.
Yeah.
And in terms of that calling, you would put your patient's best interests first.
Yeah.
So, yes, I do understand the difficulties that healthcare professionals practice under at the moment. However, they have difficulties faced in other forms of life as well. And, if you are in a profession and you have taken an oath towards furthering the best interests of your patient, towards caring for your patients with compassion, I think that needs to actually come to the fore.
It's the core of your work. It's what you do.
Absolutely. And so, you ask yourself, is it really ethics or is it a behavioral issue? Is this a sign of the decay we're seeing in the country generally?
Yeah. Which is a question we need to ask ourselves. But I suppose it's a question that you've already answered, and perhaps this was what we were talking about. What would you say could be some of the reasons behind violating the Code of Ethics? I mean, we've touched on personal circumstances, but what else do you think it is? Why? Why is it happening?
I think first and foremost, our admission criteria into medical schools and healthcare facilities, whether it's nursing or the other allied professions, needs to actually take into consideration why you want to be a healthcare professional. And I think the admission criteria generally all round needs to be reassessed. Are we actually interviewing people? Are we taking into consideration the reasons that get them to come to medical school? When you look at why people want to come to medical school, generally is, well, you're very intelligent, it's the top marks that get in, etc., etc. And so the criteria in the main is on academic performance in secondary school.
Yeah.
And is it the academic performer that will be the performer with that caring and compassionate heart.
Yeah.
We need to tie the two.
Yeah, yeah.
And therefore I think it would start with criteria for admission. I think medical schools, health science facilities generally are now have taken into consideration the need for human rights ethics teaching in their curricula.
That's fantastic. I mean, I think that's vital. It should have been there already. I just want to focus a little bit, because we're running out of time, but I want to speak about the theme of this particular gathering and the workshop that you're hosting. The symposium is working under the theme Transformation. Is it a bitter pill to swallow? Because in and amongst everything we've discussed, there's still the issue of transformation. Talk to us about this and how it's affecting the medical sector.
So, transformation seems to have developed many definitions, and it's become too broad and too narrow. So currently when you grapple with transformation, it's quite a nebulous, ubiquitous concept. What does it mean? For some it means race and gender, and others it means beyond that, it's a total change of mind. And who does transformation belong to? It belongs to all of us. Why are we over 20 years down the line, post-democracy, still grappling with some of the issues that we grappled with pre-1994?
Yeah, which in itself it's unacceptable.
It's
all these years
absolutely
later.
Unacceptable.
Indeed.
Is it because to certain sectors transformation is a bitter pill to swallow? And tonight we're going to be grappling with this. If it is a bitter pill to swallow, why should it be a bitter pill to swallow?
Yeah.
If we're looking at us as one nation, should we not all be working towards equity and access to all our social needs?
Excellent. Well, listen, we have to leave it there, but I think you've touched on some very important issues. So it's been happening from the beginning of this week. The Wits University Faculty of Health Services and the Steve Biko Centre for Ethics has been hosting the Ethics Alive 2017. It'll continue throughout the week, and these are just some of the debates and discussions that have been had over this last week. So let's hope that they're vigorous and they continue to bring out some conclusions there. Thank you for joining us here on the program. Ames Dhai is the director of the Steve Biko Centre for Bioethics.
Thank you.
Let's take a break. See you after this.